Coronavirus is leading to new concerns among health professionals.
Yeah, cancer screenings have dropped off dramatically since the beginning of the COVID pandemic 2 years ago. That's according to doctors at Intermountain Healthcare, who stressed today that those screenings save lives.
As new specialist Jed Bull shows us, they say it's a good idea to talk about those screenings.
Plenty of us put off trips to the doctor's office during the pandemic, but doctors at Intermountain Healthcare want to make sure that people don't put off important cancer screenings. They also urge us to have conversations with family members about cancer history.
Tens of thousands of Americans lose their lives every year to this disease.
Colorectal cancer is the third most common cancer and one of the deadliest. But doctors with Intermountain Healthcare say routine colorectal screenings are down 50% since the beginning of the pandemic. That's a problem because the earlier cancer is detected, the easier it is to treat and survive.
It is safe to come back.
March is Colorectal Cancer Awareness Month. Get a colonoscopy right away if you have symptoms that include bloody stool, abdominal pain, and unexplained weight loss.
There have been several patient stories where we've had 4, 6, 9 months of rectal bleeding before getting a colonoscopy. And that's just, it's too long to wait.
Regular screenings beginning at age 45 are the key to preventing colorectal cancer and finding it earlier.
It's never been more important to catch these cancers earlier and minimize the number of cases that require chemo.
As routine screenings dropped off, doctors have seen a 15% increase in patients with colorectal cancer in more advanced stages, which require chemotherapy.
This is largely, not entirely, but largely a preventable illness, and we can certainly intervene at earlier stages before you need someone like me.
You only need Dr. Mark Lewis if the cancer is sufficiently advanced to require chemo. If the cancer is detected earlier, you may never need to see him.
It's really important to talk to family members about patterns of illness and disease and medical problems to understand what we're at risk for.
Take a multi-generational approach to better understand your individual risk for cancer. It's good to know who in your family has had cancer, which type, and at what age.
You want to know in as much detail as possible what diseases run in your family.
If you're not sure when to get screened based on your family history, have a conversation with your physician. For KSL 5 News,